working 21 years at urgent care, July 22nd, and it's unsafe staffing going on. We didn't get our bonuses. They're saying we make too much money. I worked through this whole pandemic, putting our lives at stake to make sure other people were okay. But Kaiser doesn't care. They don't care about us. It's just greed and money. And we're here, honestly, from our genuine heart for patient care. I'm a carpenter in the day. Look at my boots. Yeah, and then I come to Kaiser in the evening because I love what I do in after-hour urgent care. So we need our rates.
It's affecting patients.
It's affecting the patients. It's a risk, a safety risk factor, because there's room. There could be an error. There could be a safety issue with being unstaffed. I work in urgent care, and we are understaffed. I'm one medical assistant, sometimes with 4 doctors, because you have 3 medical assistants to 4 doctors. You got one person going to the front to cover the front reception. Then you got one person doing a procedure. That leaves me with 4 doctors. That's not safe staffing. So we need to get it together, Kaiser, and let's get it together soon before something happens, like a fatality, God forbid.
And do the executives know about the short staffing? Are they aware of how bad it is?
Honestly, I don't know. I really can't state. They may know or they may not know, or maybe they're told from the uppers to keep the money in their pockets so the managers get bonuses. I have no idea.
I mean, they might get bonuses by saving money on the staffing?
They may. It could happen. It could happen. I want to say it could happen. I see that happening in the field sometimes, where certain people will try to save money here or there for their bonuses later, and I've heard a rumor about that going on in Kaiser in the past.
And that hurts the patients.
That definitely hurts the patients, and it's just not safe. You can't give the genuine care you want to give, and they need to do something about this staffing shortage, and most importantly, our wages. We're living in California, we're living in San Francisco, we need higher wages, we need our bonuses. Kaiser's made money, made $4 billion in the past 5 years, and you mean to tell me you don't have money? That's bull crap. That's crap. And I had to fight for our department so we could stay and try to get rid of us, part-time people, and wanted 8-hour shifts. We fought, thank God, our union, and the reps were behind us, and we won, thankfully, and we fought. And again, I'm proud to say I love what I do, and I'm going to continue doing what I do.
Okay, so my name is Raul Sanchez. I'm a supply chain technician here at Kaiser San Francisco.
And how long have you worked here?
I've worked here for 8 years.
And they say there's short staffing. What does that mean to you as a worker here at Kaiser?
So here, short staffing, especially in my department, meaning that we have had employees that have retired and have left, and they have not replaced those positions, and which makes it a big deal with us because we're less people now having to support the entire hospital, bringing supplies for our patients, with delays patient care. It's a big issue going on in our department, especially dealing during the pandemic and us having a lot of supplies that are on back order. We used to have 4 or 5 clerks before, for instance, that would find the outside orders for we could get to our patients. Now there's only 2 of us doing the work of 4 or 5 people before.
That sounds like a very dangerous situation.
It is definitely dangerous, especially when we're bringing supplies for our patients for the operating rooms, which I do support the operating rooms on getting implants, getting stuff. So if we're now only having 2 people trying to find them supplies, it is a big issue and a big deal. It puts our patients at risk.
And how long has this been going on?
This has been going on actually for about 3 years now. So, during the pandemic, we had a lot of employees that, over the times retired, and they just haven't backfilled. They've given us basically saying they don't have the budget to backfill these positions, but yet the hospitals are still going. We have a lot of patients coming in.
You have even new patients.
We have a lot more new patients coming in, new membership coming in with less workers. So, I mean, go figure. How do we get they're saying it's a nonprofit organization, but yet our operating rooms, we're doing double the work now with half of the staff.
And that threatens patient care?
Absolutely. We've actually, over the past year or so, been having a fluctuation of having to cut down some of the surgeries or even cancel surgeries due to short staffing, which, now it delays the patient. Patients coming in for a crucial, surgery, and it now delays the process because we have to reschedule them to come back because we don't have enough staffing.
And, also the question of oversight. Who's doing oversight of this hospital? It seems like it's screwed up here.
Yes, it is the oversight of this hospital leadership is it's horrible right now. We get excuse after excuse. We know, definitely our membership has grown. Our hospitals are still getting filled up even more over the pandemic. We have, still dealing with all these issues. And, at the end of the day, we're patients too, right? We're bringing in our family members. To bring them into a situation like that, I mean, it's unsafe for them.
And what about the government? Aren't they supposed to regulate these hospitals?
Well, I mean, our government that comes in, they regulate every 2 years. And at the time they come in, what do? We're running around hiding stuff. We're putting stuff in hallways. We're sending stuff to warehouses where we can hide the stuff. Our hallways are very packed. We're supposed to have a limited amount of, we have a limited amount of space here as it is. But, with all the surgeries and all the stuff they're coming into, we only regulate when they come in for the 2 weeks. And after that, it goes back to normal.
Well, it seems like there have been one strike after another here. The engineers,
which was one of the big ones too, and actually we came out and supported them, and they still don't have a contract to this date. That's been over, I believe, a year and a half now. So, a lot of our engineers are now coming out to support us. It's one after another.
And they did offer, apparently, the nurses a 22% increase.
Yes, I mean, the nurses were on the verge of striking, but they apparently got it right the day before they were going to go out on strike. So 22% is what the nurses got. Cost of living, I'm born and raised here in San Francisco. The inflation has raised up, more than 11%. For us to live here and off of these wages, we're down at the bottom of everything, but yet doing double the work, being mandated to do overtime to take care of our patients. Because we care for our patients, that's the reason why we're staying doing these double shifts. But it burns us out and it becomes unsafe working conditions.
And you think that the hospital system should be under public control? It seems like they say they're nonprofits, but they're making billions. The executive made apparently $16 million. I mean, it seems like basically screw the worker, we're going to make a lot of money off you.
Yeah, I mean, definitely it is for profit. We do know that. Everybody knows that. All the CEOs, everybody's making these billions of dollars. And us, the frontline workers who are caring for our patients, what do we get? Half staffing. It's terrible.
And you say that the engineers are without a contract here. Is that union busting?
Yes, it's definitely union busting. We are now, like I said, over a year and a half. The engineers were out here for 3 months with no pay. We came out here and supported. They had to come back to provide for their families and to help us out in our facilities. During that time, our facilities were a wreck. We had busted pipes everywhere. I mean, how was that safe for anything?
And where was OSHA? Where was the state of California protecting the hospital and the patients?
Nowhere to be found. Nowhere to be found. Everything that they say, we need better regulations. We need to bring somebody in here to actually see what's going on here.
Does OSHA ever come by here and really investigate?
I have never seen OSHA down here. Speaking with the engineers, when they come, it is a planned visit. Of course, at that time, everything's up to par.
So you think it's a captured agency? OSHA is really just doing the bidding of the hospital?
Yeah, they're in cahoots with it. I mean, basically, what else can it be? We have stuff broken around here all the time. It's unsafe at times. We've had stuff busting our sterile processing, water all over the place, contaminating equipment that we use on our patients. And nobody's coming in here to regulate anything.
And you think these executives should be prosecuted for this? I mean, they promise that they're going to provide health care. They're canceling patients. I mean, mental health care patients commit suicide because they can't get care. It seems like a very much out of control situation.
It's very much out of control. We see our members here all the time. I mean, mental health, you can't even get an appointment. Any type of care that you need in a surgery, you might have to wait 2 to 3 months to get it. Just because, and absolutely, they need to be held accountable for what's going on.
But people pay these fees every month.
And the fees go up more and more, and we have more and more members coming in. So I mean, something needs to be done with this. There needs to be some type of control. Somebody needs to get involved because it's just out of control.
Here, number one, I'm a patient.
Introduce yourself first. Introduce yourself. Introduce yourself first.
Okay. Yeah, my name is Maria Cristina Gutierrez, and I'm a patient of Kaiser. We work for a preschool, and all of us are patients of Kaiser, and we have seen what's been going on. We are also...
what is going on at Kaiser?
Well, when we call for appointments, they don't have appointments. They don't have appointments. They give you sometimes, most of the time, you are able to get appointments on the telephone. They don't see you. They don't really look at you. So they guessing what you have because they don't see you. The doctor cannot see you, and I don't blame the doctor. It's because they don't have enough people. And then when you go to see the doctor, they don't have a doctor. They put a nurse that don't have the salary that a doctor has, a nurse that don't have the expertise, with all respect, to do that, make him do a job that they are not paid to do. And so, it's constantly that's what happens. We cannot see the doctors. We cannot see the doctors. We cannot see. They don't come and look at us. And then they give us medicine or whatever based on what they think they have. I have diverticulitis, and they should check if I have it. No, they just give me some antibiotic so that they deal with it without even really knowing that that's what I have. So that's why I'm here in support of the workers here.
And do you think it should be privately run? It seems like they're making billions of dollars of profit.
Oh yeah, they making the profit, but this should be owned by the government. This should be the government is responsible for our health care. We pay taxes. We all pay taxes, and they send that tax money for wars, to spend it on wars. Meanwhile, we cannot, even though we pay for these doctors, even though we pay monthly payment, we cannot get it. But we can have all this money going for war and for genocide in Palestine and for all these things. So we need to unite with these workers, as they are our brothers and our sisters, and they've been mistreated and abused, and we must be here.
And Gavin Newsom, the governor, the Democrats are supported by this union, SEIU, UHW. Why do the unions support the governor and the Democrats when the Democrats won't provide public health care?
Yeah, well, because the people, to be honest with you, the people has been lied to. The unions have betrayed us because they talking about money too. They get money. I heard that some of these trade union leaders get $300,000 a year. I don't know. And the workers over here don't get that much. So how can you represent somebody that made 40 or 50 or 60, even 100,000 when you're making 300,000 in salary and 300,000 on benefits? So they sell out a struggle. We need to really unite as workers. We need to be able to form some sort of a political party, a workers' party that can really represent all of us, whether it's in healthcare, whether it's in childcare, whether it is teachers, whatever it is, that can really fight for our rights.
It seems like you're being shortchanged if you're paying all this money to Kaiser and they're not providing the benefits. Do you think they should be criminally prosecuted, these executives, for fraud?
Of course they should be. We have to do everything in our power to stop this madness. We should do it because the workers that are suffering in the hospital, being forced to do things that they're not supposed to do, sacrificing their career, their knowledge, their families, their time, and at the same time we're being ripped off. The agencies that buy and the workers that we get to have Kaiser, we're not getting the services that we are supposed to pay for. For a woman my age, you had to pay over $2,000 a month, over $2,000 a month to get health care. And some of us cannot stop working because we know that if we don't get the health care, the other health care is even worse. So we need to really start this madness and have a health care that is available to all of us. All of us. Just like the rich people get good health care, I want to get good health care.
Jesus.
What kind of work do you do?
I do sterile processing.
What's going on here?
Well, we want better benefits, better everything. We need more staff. We're short staff all the time, and we need help.
How long have you worked here?
23 years. I'm going to be 23 years in September.
Is it getting worse? It seems like they're making a lot of money, though, Kaiser executives.
Apparently they do.
Why aren't they spending more money for staff?
We have no idea why.
How is it hurting the patients?
Well, understaffed. We can take care of the patients if we don't have enough staff to take care of them. So
You feel bad about that?
of course, and we get injured too by doing so many stuff. So yeah,
Do you have to work overtime?
a lot of people work overtime. Yeah, we all.
My name is Michael Floyd. I'm a SEIU UHW organizer.
And what is this all about?
This is all about unfairness. Basically, Kaiser claims that it is a nonprofit corporation. And over the last 5 years, this nonprofit has paid no taxes, right? And in addition to paying no taxes, they don't have to pay reported income, and they made $20 billion with a B, $20 billion over 5 years, all during the pandemic. And now, after many of these workers suffered patient care, they had to be here to serve the general public, this community. Kaiser is giving one union one thing and telling the other union that they're overpaid and they don't deserve the same thing.
What do you mean by that?
So recently, the nurses union, I believe they're called the California Nurses Association, signed a contract, 4 years, 22% over the 4 years. As we understand it, Kaiser's only offer to these workers has been a 4-year contract at less than 11%. And we're saying we want equity, we want fairness. We helped you make all these profits, and it's only fair that you share with everybody.
So you're saying they're paying the nurses 22% and only offering you 11%?
In fact, they have agreed to a 4-year 22% increase.
Does that mean they don't think that your members are as important as the nurses?
I draw that conclusion. I don't know what others think, but that's my own personal conclusion, yes.
They say that they're a non-profit. Are they a non-profit? I mean, it seems like they're making all this profit. Where's the money going if it's not going to the workers and the staffing?
So, where the money is going is back to Kaiser. I mentioned how they doubled. They didn't pay any taxes. They haven't paid taxes since they've been established. But the money that they had in investments and savings doubled over that 5-year period. And they still haven't paid any taxes on it. As a matter of fact, there's a bill going through the California state legislature that's going to call for accountability of all healthcare institutions so we can see exactly where Kaiser is spending that money and what they're investing in.
Do you think they should be privately run? You have Sutter too, the same thing. It seems like the Governor Newsom is getting his dinners paid for by these hospital associations. I mean, do you think it should be under public control? I mean, as in Canada, for example?
What I'm going to say is my own personal opinion. I do not represent anybody else but myself. Yes, I think it's long past due we have single-payer health care in this country. These workers actually have to pay. They work at Kaiser, and they have to pay for their own health care. That could be spent towards wages. It could be spent towards better facilities. If you go inside here, this building has probably been built in the 70s. The elevators don't even work. All of the elevators in this building, right? I think there's much more better things that this facility would be like if it was run by a public entity.
And during the last engineers strike, there were floods here. The building was in disrepair. It seems they allowed it to continue operating even though it was a danger to the public and the patients.
Yes, and those same engineers that you speak about, even though they went back inside, they still haven't settled a contract in over 2 years, right? And when we say equity and fairness, we're all part of this labor community. We're all part of this struggle, this fight, whether you belong to a union or not. Right? And so, yes, we're here fighting as a coalition.
A lot of union members belong to Kaiser.
Yeah.
And do you think that they should be mobilized to support this struggle? I mean, it seems like union members are unaware of what's going on at Kaiser.
I definitely think they should be made aware. There's an organization the AFL-CIO, there's the San Francisco Labor Council here. There's many other groups of organized labor who could band together and support us. I look forward to Labor Day when we make this a much more public fight, and maybe then they'll have the opportunity to chime in and join us.
Medical assistant at Kaiser.
How long have you been a medical assistant?
Medical assistant for about 20 years now.
So what's going on here today?
We are here to ask Kaiser for safe staffing to give our patients quality care. We're short staffing. We are not able to provide the quality care our patients need.
And you're saying that you don't have enough staff to do your job?
Yes.
What does that mean concretely?
Meaning that if we don't have enough staff, our procedures are being canceled or delayed. Our patients are not getting the quality care they need. I can give you an example. Myself as a patient, I brought my son a couple of months ago for an accident he had to come into the ER. Waited an hour and a half to be seen for a 15-minute appointment. Then had to wait to get a CT scan another 30 to 45 minutes. Then wait for the results another 30 minutes, and then send home. Wait for in the pharmacy another 20-30 minutes for the prescription. That was a 3-4 hour appointment that could have been done probably in an hour or less.
And Kaiser executives apparently are making a lot of money.
Oh yes, Kaiser has been making billions of dollars and saying that workers are overpaid.
And how many workers are in your union here at this facility?
We have about, I would say, about 1,500 to 1,800 in San Francisco.
And there have been other strikes here, UHW, mental health care workers, stationary engineers. What's happening with those workers?
So our nurses did get a good contract, but our engineers haven't. It's been 2 years, since 2019, that our engineers have not gotten a contract. And a lot of them have left Kaiser because they need to provide for their families. Living in San Francisco, it's not easy. Working in San Francisco and not getting paid enough to be able to survive in San Francisco, it's definitely not something that a lot of us can do. Growing up here in the city, working in the city, having our whole families here in the city, and now not getting paid enough to stay, it's hard. It's hard.
And Kaiser says it's a non-profit. What does that mean to you as a worker here?
Well,
you think they're doing it for profit?
I definitely think they are. I mean, if you can have one medical assistant or a nurse take care of 3 patients when you should have 2, how much are you saving there? You're saving a lot, but we're not giving the quality care that the patients need, right? Kaiser prays about quality care for our patients. Are we?
Are workers unhappy here about the fact that there's a low staffing?
Yes, of course. We're sad. No, we're unhappy because, once again, patient quality, patient care is affected by our staffing, not only ourselves. I'm a 32-hour employee, and I get called in to work on my days off. When they can hire people to be there all the time, what about if I can't come in to work on my day off?
You think that they should be privately run? You think that it should be public health care? Seems like they're in the business. Sutter, all these chains are making a lot of money. They're executives. You think they belong in private hands?
I cannot for sure say that. I've not worked in a private hospital, so I wouldn't know the difference. However, I think that Kaiser could do better to treat the patients, our healthcare workers better in order for our patients to get the quality care they need.
And if people are denied health care, although it's required to provide it, they promise that they're going to provide health care. They don't provide it because of financial reasons, because they have a lot of money. You think they should be prosecuted criminally? I mean, these people are promising things. It's fraud. They're lying, like mental health and other things. The clients, the patients, are not getting the care that they are promised by Kaiser executive.
Well, definitely, once again, this is the short staffing issues that we have. Kaiser cannot provide the quality care that our patients need, or even patients that don't have insurance, because we don't have the adequate staffing. That's the big problem here. If we were to get the adequate staffing, then we could probably provide that care that that everybody needs, with or without insurance.
Well, Kaiser is making a lot of money. Why aren't they doing it?
That is a good question. That is a good question for Kaiser to answer. That's what we ask every day, and we don't get an answer.
And are there other unions who are supporting you?
Yes, so our union, SEIU UHW, is one of the biggest unions in the nation. So yeah, we have a lot of sisters unions who are here. Engineers were here out picking with us today, and we supported them back in 2019. They were here today supporting us as well.
My name is Robert. I work at Kaiser, San Francisco, SEIU Stewart.
And how long have you worked here? What kind of work do you do?
15 years, and I work in patient transport.
And what's going on with that department?
You know, what we've seen throughout the pandemic in these last few years is the staffing levels really being detrimental to patient care. The patients can't get to where they need to go, or there's not enough staff to adequately, safely move the beds or journeys, which require 2 people per move. You know, it just adds an extra level of insecurity to the patient care and stress on the workers that do show up and do have the job.
Well, how short are you?
It depends on the day. It really depends on the day. We've been down to having 1 transporter for the entire hospital.
1 transporter for the entire hospital?
Yeah, but that's not an everyday thing, but it does happen enough to where it does affect the care.
And have you asked for more transporters?
Definitely.
And what do they say?
They have only given us per diem positions, not benefited positions that we can guarantee and count on being there week in and week out on the days they say they are.
You mean just contract workers?
No, not contract workers, people who don't have a set schedule to where they're not guaranteed to cover the patient care needs throughout the week. They're supposed to be called as needed basis. That's not what we need. So it's a stopgap measure that they try to put in place to appease labor and their complaints they've raised about the patient care issue and the short staffing.
And the executives apparently are making a lot of money, millions of dollars. The CEO.
No way around that. That's great for a not-for-profit.
You think it's a non-profit?
Oh, I mean, tax-wise.
But actually, I mean, if they're not providing proper staffing, I mean, and they're making a lot of money, what's going on?
I mean, I'm not on that level. You know, the devil's in the details, I'm sure, but that's not my expertise. All I see is the effect it has on patient care. The penny pinching is not what we're supposed to be here for. We're supposed to be here for the patients, for their care, and taking into account a budget versus the well-being of our patients isn't where this company should be headed.
So you're saying it's really shortchanging the patients?
Definitely.
And there have been other strikes here. The stationary engineers, mental health care workers, seen one strike after another. What's going on? Why all these
Kaiser's just practicing how to break us unions. You know, the organized labor is only about 10% of our national workforce. When we were in our heyday and the middle class was built in this country, it was based on organized labor. These corporations, Kaiser and the rest of them, have had a concerted effort over the past decades to break unionized labor. When the labor is organized, it's the best for the workers, period. It might impact the pocket of the CEOs, but when you take care of your workers, you get better workers to take better care of your patients. Simple math.
And what about the laws regulating the hospital? I mean, Kaiser's promises people that they're going to provide care. If they don't provide it, like mental health, why aren't they being prosecuted by the government for lying to people about what they promised? People pay fees to go to Kaiser.
Definitely, but
Gavin Newsom, I mean, apparently he's takes his orders from these executives. He was at that party.
Oh, I don't think any of that is, what do you say, specific to Kaiser. That's just the way it is now in politics. You're not.
You should have.
The electorate is not represented.
You think they should be privately run? I mean, you think you should have? Yeah, Kaiser and Sutter. It's not just Sutter, Kaiser. All these companies seem to be making billions of dollars. Yet people are complaining. The workers are complaining. The patients are complaining. They're not getting proper care.
No, definitely. I mean, the only thing that is going to sway it is the patients in the end, because that's who we're here for. So,
what is the union doing to reach out to patients? Do you have a flyer for patients? Are you getting a petition? A lot of union members are members of Kaiser.
Oh, what the union does for the patients is to provide the care. First of all, that's who we're here first and foremost. So the union isn't just the union leadership, the elected officials, or the staffers that are hired on. Every one of these workers around here are the union, and these are the people that provide the care day in and day out. It's not the executives that are providing the care that these patients need. That are not the ones that are keeping these patients alive. These are the faces of the workers and the union that provide the care to the community.
And what I'm saying is a lot of union members go to Kaiser.
Well, that's because Kaiser was founded on a union basis. The first members were people who worked in Kaiser steel yards and Kaiser shipyards in the concrete. He made this for his workers, but Kaiser seemed to lost their way. They seem to try to break the unions now instead of embrace them.
And this union busing that you're saying is going on, where's it coming from?
Oh, that's been a concerted effort by the, for lack of a better word, the powers that be.
Not the capitalists?
Definitely, but so I mean, there's not a sector in our economy that hasn't tried to break their unions. The reason why our union stays strong is because you can't break healthcare. You can't ship it to China. It's always going to be here. You can't send it to Mexico and build the cars there. The care must be provided in this country. We're strong enough to keep it. That's why this fight is so important. Because there's only very few sectors in our economy that can still hold on to their unionized labor.
And it seems like there's strike after strike here. As many strikes have been at Kaiser. Why isn't there a united action of all the workers? It seems like if you all went out together, all workers, there would be a pretty quick strike.
I believe that's why Kaiser has our contract split up in years. If we're all in the same year, they'd have us all at the same time and be a whole different problem. But they know what they're doing. That's why they broke the engineers the way they did, practicing trying to break us.
And what's happened with the engineers since the strike?
The ones that came back maintained employment, but they're working without a contract, without protection. They only have the pay and the benefits that were in place. They have nothing set for increases to adjust to the cost of living, to any of the inflation that we have going on right now.
So isn't that union busting?
Definitely. So yeah, they got away from their core message. Kaiser always was embracing of the unions. Now they try to bust them.
So they actually are working here without a contract as stationary engineers?
Not just here, but across the region.
What do you think about that?
Oh, that's unacceptable.
Well, if they're working without a contract, they could all go out and join you, couldn't they? If they have no contract.
Yeah, they paid their dues. They were out here for 90 days without pay.
But I mean, a United Front, I mean, they don't have a contract.
They don't have a contract.
So they could go and join. They could go on strike with you without a contract.
That's up to their union and their locals.
You think they should?
It's up to their locals. I'm not part of that union. We were out here in support of them when they went on strike. I know that we have their support, if not physically, then morally. They're our brothers and sisters in union and in organized labor. We support them all. Just like the big win the Teamsters just had, the more wins organized labor can have, the better off we all are.
And what do you think what can people do to support you?
What they're doing, show up, give us our honks, let Kaiser hear you, let Kaiser know that you support their workers and organized labor.
My name is Charles Minster. I'm a retired trade unionist and a supporter of the International Communist League. They call for a workers' government and a socialist society. And today we have Kaiser organized workers, unions representing all the unions inside, marching for patient care to raise the staff levels. But they're not talking to the community about what the community needs as far as health care. We need free health care at the point of delivery so that nobody is turned away when they need health care. In this country, if you don't have money, or if you're near death and you don't have a proper health care. But they continually think of themselves. I'm talking about the leadership. Keep it in the house because they're afraid of people like myself and others and revolutionary thinkers getting in contact with the workers because of the need to do something for the community as a whole. So that's what we're.
Isn't that business unionism?
Business, yes, that's right, Steve. Business unionism. That's the name of the game. The SEIU is one of the worst of those types. They got no meetings hardly at all in any of their locals. They got locals that are so huge that it's bureaucratically run from top to bottom. So yeah, that's all they are. They think about their numbers and how much dues is coming in. Is that the most important thing? And how much they can give to the Democratic Party to keep us screwed.
And what's the San Francisco Labor Council doing about this?
Nothing. In fact, the San Francisco Labor Council is not even sending out any more alerts about these kind of events happening. The last dozen or so events has not been covered by the AFL-CIO Council. They just don't care. They don't want outside people coming here, I guess. You know, they don't want the public to come here and support workers. They just wanted little bailiwicks or the bureaucrats who were just standing next to us here.
And this private so-called nonprofit, it seems like Gavin Newsom represents Kaiser Management, the hospital association. They were paying for his party where he was meeting without a mask and being paid for by the hospital association. What does that say, and why are the unions silent about that?
Yeah, well, again, you know, they support the Democratic Party, and the Democratic Party pulls their strings. And if they do anything against the Democratic Party, that bureaucrat might be stomped, might be finished.
And there have been strikes here before. The mental health care workers, they weren't providing mental health. The stationary engineers, you've been on this picket line here. You've been on one picket line after another here. I mean, what have you learned in these picket lines with all these different unions going out separately, not together?
Yeah, well, that's the key to labor winning anything. I mean, it took a lot for the AI for the actors to come out in support of the Writers Guild. But here, just simple math, just simple knowledge says that if all workers go out, then the hospital is in a tough shape, and that strike could be settled immediately.
My name is Angelica Lieberman. I am a radiology transporter.
How long have you worked here?
I worked for Kaiser for about 5 years.
What do you think about what's going on?
I think we're in a staffing crisis, and we need safe staffing to provide the proper patient care that we promise.
What does that mean for a patient that comes in here as far as safe staffing? How would they know what's going on?
Well, there'll be a delay in the call lights. There will be a delay in any kind of procedure. There will be a delay in, for example, in an X-ray or CT scan. And it just, instead of a patient waiting 20 to 30 minutes, they'll be waiting more like an hour.
And you're saying it's unfair for the patients?
It is unfair and unsafe.
And why won't they hire more workers?
I don't know. We're in the middle of bargaining that, and that's one of our requests, to backfill all open positions and open new positions.
How long has this been going on?
For over 6 months, and the crisis of short staffing has been going on since before COVID.
Well, the other unions that have been out here, healthcare workers, engineers, say the same problem exists. Is it true in other departments?
Absolutely. I think for engineers it will come down to equipment. For us it's patient care as well.
And what can patients do about it who are unhappy about the fact that there's not proper staffing here?
They could join us on the picket line. They could actually do reviews. They could reach out to management. They could reach out to HR. They need to provide the proper funding for us to be able to provide the proper patient care.